I've got a very interesting guest on today, Dr. Sarai Stancic. Welcome.
Thank you, Mitchell. It's a pleasure to be here today.
And so I came across some information on the Forks Over Knives site, and I saw your story there, and it really sort of captivated me. And I wonder if you could just dive a little bit into your story and your health and your transformation.
Sure. So it was October 1995. I was really at what I thought my best. I was a third-year medical resident, had just been asked to be chief resident the following year. A month prior to that, I had just met my future husband, so I was really living the perfect life. And it came this one evening. It was October 11th, 1995. It was an extremely busy call for me. I was just running around from the ICU to the emergency room, and I remember feeling this intense fatigue that I had never experienced previously. Finally, around 2 o'clock in the morning, I made it to my call room, and I just, instantaneously fell asleep. Within, an hour or so, I was paged again. And at that time, when I went up to get up, I couldn't feel my legs. And it was,
Wow.
Acute presentation of multiple sclerosis. And certainly thereafter, I had an MRI in my brain and spinal cord. There were multiple lesions in both brain and spinal cord. So life changed really dramatically for me, acutely, overnight.
Yeah, definitely. What do you remember? What sort of went through your mind? I mean, obviously, as a medical resident and physician, you probably had a variety of scary thoughts that went through your mind about what this could be when you.
Right. Well, physicians are the worst patients.
Definitely.
So, of course, I think it was pretty obvious to anyone, the mid-20s, acute neurological changes, it's multiple sclerosis unless proven otherwise. But in my head, I was I must have worked out too much, or it was the heels that I was wearing the day before. You're pretty much in denial. And it wasn't really until I heard the words. And it's interesting, the way I learned the diagnosis was really unfortunate. I had sat through like 2 hours of an MRI machine, which was traumatic, to say the least. And as I'm being wheeled out, the radiology attending screams out to a couple of medical students and residents, says to them, get the whole team over here. Look at these wonderful images. This is classic multiple sclerosis, and that's the way I learned it.
Wow. That's horrible.
Yeah.
And so the night that it happened, did you go down to the ER as a patient, or did you just weather through the call and suck it up like we often do?
No. I mean, when I couldn't really move, so I was immediately transferred over to the tertiary care center at my medical school in Newark, New Jersey Medical School. So I was actually sent over immediately.
Wow. And so then what happened after that?
So after that, I was admitted. I was given, 5 days of IV Solu-Medrol, and I think that whole lots of testing was completed, and obviously the diagnosis was made. And the plan was that I was going to start beta interferon. That was the drug of choice at the time in 1995, and so I began that daily interferon shots. And I don't know how familiar you are with interferon, but it's a pretty horrific drug.
Right.
So every evening I would inject myself, and then 2 o'clock in the morning I would wake up with shaking, chills, a flu-like illness. Certainly neuropsychiatric side effects were problematic, depression, injection site reactions, and I did that for some time. And again, this is a preventative measure, and I just really spiraled. And I ended up, and there were medications that I was taking to manage the neuropathy and the pain that I had in my lower extremities, Neurontin, amitriptyline, medications to address my hypertonic bladder. So before I knew it, Mitchell, I was on a handful of drugs and really living a life severely compromised. My quality of life was really not what I wanted it to be in my early 30s. And so I searched for another way to manage this chronic illness. And I think I've seen just about every neurologist in the tri-state area looking for a way. And it wasn't until I came across this sort of really silly, unscientific study in like a throwaway medical journal about multiple sclerosis and blueberries, and it was, that's what caught my eye. It was a study looking at MS, and it was like maybe 60 patients. This is not a statistically significant finding, and when I read the article, it was sort of, I didn't think much of it, but what it did, and the article was about, patients with multiple sclerosis who ate a diet rich in blueberries were subjectively less symptomatic, and I thought that was interesting, and I started to think a little bit more about this, and what this article did was sort of, turn on that light. Is there something about how we eat that promotes chronic illness, the development of chronic illness? And so I became very interested in nutrition, and not just nutrition, but lifestyle. How we eat, how we move, how we manage our stress. Does this play a significant role in the development of chronic illness? And of course, my search began because of my personal story, but it extended beyond obviously just autoimmune disease and multiple sclerosis, but also the common causes of death in this country, cardiovascular disease and stroke and diabetes. How could we alter that path in managing patients? And, I started to incorporate, I started to learn more and more about this stuff. I mean, there's an interesting paper that was written back in 1952
Wow.
by Roy Swank in the New England Journal of Medicine about nutrition and the prevalence of multiple sclerosis. So this wasn't anything new. It was just something that I had never. I mean, I don't remember ever hearing much about nutrition during medical school. It wasn't a topic that we spent a lot of time on. We spent a lot of time on pharmaceuticals and procedures managing chronic illness, but no one really talked about prevention and what role nutrition could play. So it was really my own self-education and just this real interest in learning more and more about the role it could play. And what I found interestingly was that there's ample evidence in the scientific literature to support the prevention of chronic illness and even the amelioration of chronic illness by changing our diets. And studies like the Diabetes Prevention Program, where they took pre-diabetic patients and randomized them to either receive metformin, which is of course what we typically and conventionally use in that setting, versus lifestyle intervention and this was a randomized controlled placebo study. And when you look at these patients 4 or 5 years out, you see that, yes, metformin was wonderful. It reduced the likelihood of developing diabetes by 30%, but, lifestyle intervention was twice as effective, 60%. But we don't talk about that as clinicians.
Right.
So we need to shift our approach and talk to patients about the importance of the choices and the behaviors that they adopt in regards to their clinical health outcomes. I mean, we play a role in this, and it's significant.
I totally agree. I think if I think back to my medical school experience, we had maybe an optional couple hours of nutrition lectures that we could attend, and they were poorly delivered and probably not of a lot of value. And so definitely there's a huge role and gap, I think, also because physicians are so busy in finding the time in a traditional medical model to educate patients. It's difficult.
I agree, but I think there's a sense, I'm beginning to see a shift that physicians are becoming more and more aware of this. It's interesting, the president-elect of the American College of Cardiology, Kim Williams, he wrote an editorial about this very topic, where he found in 2003 his blood cholesterol was elevated, and he changed his diet. He's now a vegan, and he corrected his hypercholesterolemic state simply by changing his diet. And that was interesting because we have a very prominent physician, again leading, elected for the American College of Cardiology, speaking this way, which I think is very important and hopefully will set the tone moving forward.
Yeah, definitely a huge shift needs to occur. Can we just jump back a little bit? So you were going through all these treatments and administering interferon to yourself at home, which is a huge undertaking. I can't imagine a non-medically trained person doing that. How long did it take you to sort of get stabilized with your MS and then finish your residency and get out into practice? How long did that period take?
Well, I mean, I was able to finish, at that point, I was a third-year medical resident, and I went on to finish my residency and then complete I did a subspecialty in infectious diseases successfully. I was able to do that, but it was, it was difficult because of, the side effects of the drugs.
Right.
So certainly, it was just much more complicated because of the medications. And on average, I would have 2 to 3 exacerbations, I would say, per year. So, I mean, I was managing the disease. I was able to work and maintain my lifestyle. You know, I got married. I even had a child. But again, it was difficult. And I think I reached a point around 2002 where I really felt that I needed to do something drastic. And it was at that point that I think just a lot of things came together for me. That article, learning more about Swank's work and learning more about, you know, other physicians with similar scientific backgrounds. And then I decided that I was going to discontinue the medications that I was on because the quality of life that at the time was just suboptimal, and I wanted to attempt to do this by changing my lifestyle. So then I just started to I started to cut out foods that are less optimal and introduce a diet that was rich in vegetation. So primarily the diet that I talk about and that I promote is one consistent with, you know, whole food plant-based diet, or a diet rich in fruits, vegetables, whole grains, and legumes, because those are the foods that are rich in those nutrients that are so important in maintaining health. So I did this over a period of, you know, years, where I started to just really improve my diet, and then I started to do something that I never thought I could do, is start to run. You know, for years I walked with a cane or a crutch, and I had significant peripheral neuropathy, and I can tell you there were years where I didn't feel my legs. I mean, it was very difficult. And, you know, in 2007, my brother ran the Los Angeles Marathon. He's a pretty avid runner, and sort of inspired me to try. And the first day I tried to do any running, I think I fell several times and I might have run a block, but I started to, you know, just little by little continue to add on. And in 2010, I ran a marathon, which was really a wonderful experience.
Awesome.
Yeah.
That's quite a journey. And so when you started to incorporate these dietary changes, lifestyle changes, and take yourself off your medications, did you get some pushback from your physician, your neurologist?
Oh yes. They were not happy with me at all. You know, I had many neurologists say to me, if I discontinued the interferon, that I would, at the age of 40, and I'm way beyond 40 at this point, I would be in a wheelchair, and that, you know, I was making a poor decision, and that, you know, there would be ramifications to it. And I understood that. I understood that there was risk associated, and I would never advise a patient, an MS patient, to discontinue their you know, disease-modifying drugs. I think that's a decision that needs to be made individually with their neurologist, and, you know, weigh out the risk-benefit of any decision that you make. But for me, it was the one that I needed to make at the time, and thus far, thank God, it's worked out well for me.
Yeah, definitely. And so you know, you have the benefit of being a trained physician, interpreting some of the medical literature on food, or food as medicine. How does the average person sort through what's out there? I mean, I was just looking at a running magazine this morning that was talking about touting the benefits of you know, fats and eating cheeseburgers for athletes, and so it's very confusing for the general public.
It is very confusing. There's always a new book out, you know, the wheat belly or the paleo diet. Everyone has a different perspective. And, you know, the science behind a lot, and it's dangerous. And there's a lot of celebrity physicians on television promoting this supplement or that supplement, or this food item, or, you know, gluten-free it has been, you know, prevalent. You know, a couple of celebrities go gluten-free, and now everyone wants to go gluten-free. And so there's a lot of misconception and messaging that's out there, and it's difficult to comb through it. But what I tell patients is, you know, we need to look at all of these different diets and understand that these are all fads. There's very little science behind it. And what I talk about is evidence-based medicine. You know, what does the literature tell us? You know, there is literature out there. You know, I just talked about the diabetes prevention program, but the Potsdam study, a large study done by the EPIC investigators in Europe, looking at 23,000 Germans, and what these investigators wanted to look at is what what was the relative risk reduction of chronic illness in patients who did 4 simple things, 4 simple behaviors. They didn't smoke, they maintained a healthy weight, they ate a diet rich in vegetation, and they exercised daily. And it wasn't anything extraordinary, a 30-minute walk. And when we looked at those patients over a long period of time, what did they find? In this patient population, patients who abided by those healthy behaviors, there was a 93% reduction in the development of diabetes, 80% reduction in myocardial infarction, and so on and so forth. So we see a significant reduction in chronic illness when we adopt these behaviors. So that's the science that supports what I'm trying to promote. And then when you look at the world in its entirety, Dan Buettner's book entitled Blue Zones.
Blue Zones, yeah.
Yeah, I mean, you look at these people. What are these people doing? They're doing those very same things.
Exactly.
They're managing their stress. They're eating a diet rich in vegetation, and they're moving every day. So these are the behaviors we need to adopt to maintain health and wellness.
I agree. I mean, 4 simple things to reduce the chance of diabetes, heart attack, and death. Did the study, did it give an idea what the body weight, was it a BMI measure or what?
It was and actually it was very generous. This BMI less than 30.
Really?
In the Potsdam study, yeah.
Okay, so that would be considered, some obesity.
That would be considered, yes. Obesity is defined as a BMI greater than 30, so it would be considered certainly overweight. So BMI between 25 and 30 would be considered overweight. So this was a very generous in regards to weight, but again, these are simple behaviors that we can all, I think, quite easily adopt. But I think particularly in this country, I think that there has to be a societal change. We need to change our perspective. Just the other day, I went out to eat, and in every restaurant, you have children. There's a kids menu, right?
Right.
And what's on the kids menu? It's always the hamburger, the hot dog, the pizza, and the chicken nuggets, right?
Yeah.
I mean, the most important time for us to develop good eating habits is when we're children. And it's so important that our children eat properly. And it's not acceptable for them to be eating these foods because this sets up where we are today.
I totally agree. I'm sure you see this in your practice. There seems to be quite a disconnect between reality and what patients practice. They want oftentimes, can you give me just a pill to fix the stock? I'll work on my diet later. And what are your thoughts on that or approaching that with your patients?
Right. Well, here's the thing. I have a very unique practice, Mitchell. I don't do any prescriptions. I strictly do lifestyle medicine. My role is not to be your general internist, and I'm an infectious disease physician by training. I've practiced for almost 20 years in New York, and so I started this practice as this was my passion for years, and this was something I wanted to do, and I started it a year ago. And my practice is simply about educating patients on how to eat properly. So patients will come into me and they know right off the bat, I'm not going to write a prescription. I mean, that's not the type of medicine that I practice. What I do is I take a very thorough history and physical, and then and the first initial visit with me is 2 hours, where we talk about what is the important, what does an optimal nutrition plan look like? What is a physical activity regimen appropriate for that individual patient? And also managing stress, because it's those 3 components that are very important in maintaining health and wellness. So I don't do that, and I make it clear to patients. I'm here to, and it's not about cosmesis. It's not about fitting into a dress for a particular party. It's about achieving, optimal cholesterol, lipid profile, blood glucose, blood pressure, all those things that are important clinical endpoints. Those are the things that I want to discuss. Pre-diabetic patients that come to see me, it's about assuring that they're eating properly to get that glucose insulin axis corrected, weight loss, and patients can reverse these pre-diabetic states.
Definitely.
Another thing that I see plenty of recently is fatty liver disease, particularly in young patients who are carrying too much weight. About 30% of patients, obese patients with fatty liver disease, which is a huge problem, which can turn into non-alcoholic steatohepatitis. And we've even seen in the literature patients developing cirrhosis from excess fat.
Really?
So
wow.
Yes, absolutely.
Yeah, it's going to be a huge problem as our children become more and more obese with the, I guess, the dietary crisis, if you will, in our country. It's going to be a rampant problem.
It's problematic. I'm grateful that our First Lady has brought light to this. And I think this past year, I think for the first time in the NHANES data, we're looking at rates of obesity. I think we've peaked at a shade under 35%, and it hasn't, because for the past several years we've been climbing, and it seems like we sort of leveled off. And also, I think we've seen some when you look at the obesity rates in children, I think we've also seen some leveling off and also maybe some improvement over the past couple of years. So that's all promising data.
Yeah, certainly encouraging. And so do you do any traditional medicine now, any hospital medicine?
I don't. For years I was practicing at the VA hospital in New York, and I gave that up about almost a year and a half ago.
Okay.
And I'm strictly doing this now, and hoping that the practice continues to grow and the message continues to be promoted.
So did you get any pushback or negative comments when you left? Obviously, you're highly trained with a subspecialty fellowship, and you go from, treating resistant infections to pushing plants, if you will.
Right. I think many of my wonderful colleagues, question what are you doing and why have you done this? But it was, it's been years that it's sort of been on my mind, something that I really wanted to do. I'll tell you, in 2005 at the VA, so, I'm practicing infectious diseases at the VA, and it's not a common consult that I would see would be, an infected diabetic foot ulcer, right?
Right.
So the question to me is, Dr. Stancic, what antibiotic should this patient be placed on? But, I would spend 10, 15 minutes on, discussing what antibiotic, and then I would spend the remainder of the time for the consultation talking to this patient about achieving, about changing their diet and promoting an exercise regimen. And in fact, I was chief of infectious diseases at the Hudson Valley VA in New York, and we have this beautiful campus right on the Hudson River. And at lunchtime, I would make all my patients walk at the campus, and it was wonderful. And in 2005, the VA employed a program called the MOVE program, which was great. Again, obesity and overweight, big problem in the VA.
Definitely.
And I volunteered for that. I said, I want to lead that at our facility, and so I started to do that program as well, and again promoting, because I saw the difference in my life. I mean, I had become, again, this is anecdotal, but I knew from where I had come and how severely compromised my life had been, to one that now, I was thriving and energetic, and certainly not feeling, like a compromised, fatigued MS patient. I felt like a new person, and it was a message I wanted to share with the world. And even in managing, infectious disease patients, HIV patients, and hepatitis patients, of course, when we address all of these parameters, lifestyle behaviors, whatever chronic illness you're managing is going to be better. I mean, the depressed patient that decides, 75% of VA patients have a mental health diagnosis. If we, in those patients with diabetes, or rather with depression or PTSD, if we employ a regimen where they're eating better and they're exercising, that's going to have benefits to address mental health issues as well. So this is something that everyone should partake, and it's not anything specific to one individual or another. I mean, if we all did this, whatever our baseline is, it's only going to improve.
I would imagine that some of these patients were probably one of the first times that they were talked to about these things. I mean, they've been dealing with obesity, and here they have an infectious disease doctor talking to them about their diet. They were probably, pleased with the information, but also a little bit surprised that nobody brought it up before.
I think they were. I mean, because these patients are coming from the general internist and they're coming to see me. But, Mitchell, what would happen, and this is what I saw time and time again, right? I would have that infected diabetic foot ulcer come see me, antibiotic, the patient doesn't respond, they end up with an amputation, right? First, below the knee and then an above the knee. And so what happens now? This patient is a 55-year-old veteran, amputated, right? Now becomes even more sedentary than he was before. And his diabetes is now more poorly controlled, develops cardiovascular disease, stroke. Next time I see him 5 years down the line, now he's in the nursing home. He has Alzheimer's disease, and they're calling me because he has, a Foley catheter and a urinary tract infection, and he's he's spiking, and they want to know, what do we do now?
Right.
And this is what happens commonly. This, patients just spiral. And what we need to do is that very veteran, the one that came to see me with the infected foot ulcer, we needed to target that patient, 10 years before, when his blood glucose first started to, when we started to first see some glycemic abnormalities, and correct course then. And that's where the focus needs to, at least that's my opinion, that we need to focus in prevention more than, we're very good at acute and chronic management of chronic illness, but
right.
The problem is
the horse is already out of the gate at that point.
Exactly.
I'd like to see some education. I've got a 14-year-old son, and we were visiting a friend at the hospital and saw that very patient you're talking about with the bilateral amputations. And my son was like, well, I don't understand, what does diabetes have to do with losing your legs? And then he had questions of how do you get diabetes and what does diet have to do with it and all those things. And I just was kind of a little bit taken back that he hadn't had some knowledge or some discussion in a health class along the way, or some nutrition advice or something that, our kids really should be hearing from someone else besides their parents.
Right. It's just absent, and I'm not sure why. Even in our community, we live in a lovely community in northern New Jersey, and you look at the lunch menu at our school, and again, it's those same foods that we talked about previously. Needless to say, my children take their lunch to school, but it's really disappointing because we should know better, and we don't at this point. I'm not really sure why we're not connecting. Not too long. I think last year I wrote there's a Burger King inside of the cafeteria in the hospital in the medical school which I graduated, which has been driving me crazy for years. So I wrote a brief article on it, and I posted it on LinkedIn, and I got a lot of comments, and I would say 80 to 90% of them were really positive, but there was a group of folks that were really annoyed at me for even commenting on the fact that freedom, we should be able to choose whatever we want, and that's fine, but my concern is, why is there a Burger King inside of the hospital, inside of the tertiary care center in within our facility? What does that tell the typical patient?
Right.
That this is acceptable nutrition. And you could go there, Mitchell, go to the cafeteria, and you see patients still with their patient, wristlets on, ordering Burger King, and even the cardiologist sitting there eating a Whopper. We really need to set the example, particularly as physicians. Everything that I'm telling you to do is what I do on a daily basis. I run, I walk, I exercise every day. I eat this type of food because this is the type of food that keeps me well, and that's why I'm recommending it to you. We need to live that example.
No, definitely. When I left the hospital the other day, I was walking out, and there was a huge cooler sitting there that said free, and inside it was just packed full of ice cream. And so, I was unmonitored, and patients and whoever walked by were grabbing handfuls of all sorts of ice cream bars. And I like ice cream from time to time, but I think it was sending the wrong message, definitely.
Right.
And so,
I like ice cream too from time to time.
All right. Well, I want to respect your time. I just want to finish up with two questions here. And so the first is, can you just describe what your ideal day would be, whether it's just practice or not practice related, just life in general?
Oh boy. For me, that would be a hike with my family, definitely.
Okay.
We're pretty outdoorsy, and just being outside and going for a really long hike, that's one of my favorite days. Absolutely.
Yeah, I love definitely connecting with nature. And you mentioned a little bit about stress management as one of the techniques that you work with your patients about. Can you just share a little bit about maybe your favorite stress management?
Yeah, absolutely. So I'm a big fan of meditation, yoga, things like that. I'm also, one of the books that I recommend highly for patients is The New Earth by Eckhart Tolle. I'm a fan of Tolle.
Yep.
I think I've read that book. I probably read it two or three times a year, and listen to it often when I'm running or if I'm having a difficult day. Just listening to him reduces my stress levels. But I think it's constantly, it's about, assuring that you're living in the moment and not, I think often it's about perspective. We take small situations in our lives and we explode them, and we take them to heart so heavily, and we end up, and we know that stress affects us biologically. We know that when we're highly stressed, cortisol levels are increased and insulin levels are increased. And Elizabeth Blackburn has done a lot of work at UCSF with telomeres, and she won I believe she won the Nobel Prize in 2009 for her work in telomeres. And we know that patients who are highly stressed, their telomeres are shortened. So there's a lot of science out there that supports that being in a highly stressful environment creates illness. So that's something that I point out to them. And every patient is different. They may be whatever works for you, but finding that space where there's quiet, where you're away from the rat race. It's a very difficult time to be living nowadays. There's a lot of stress. It's 24/7.
Completely. Yeah.
Social media. It's tough being a kid nowadays. Everything's there's really little privacy, and there's a lot of exposure. So all of these. I think things add stress to our lifestyles. So whatever we can do to just find those moments of quiet, I think, are important.
Yeah, very, very difficult for kids to unplug as well. But I definitely, Eckhart's message is powerful, and his voice is very soothing, and
Yes.
I love that. So where can people find more about you or your website or connect with you?
Right. So my website is stancichealthandwellness.com, and my practice is in Ridgewood, New Jersey, and I guess that's basically it. And you can reach me on email. It's stancicmd@gmail.com. I'm happy to hear from anyone.
Excellent. And do you connect with patients just in the office, or do you do some phone-based consultations or internet consultations?
Yeah, well, primarily in the office, but I do phone-based consultations. I email my patients. I text my patients whenever I can. How are you doing? Follow up. I do house calls. I'll go to your house and we can go through your kitchen and your cupboards and make sure that what you've got in there is in alignment.
Nice.
What needs to be done. I go food shopping with patients. I prepare meals with patients. One of the things that I want to do hopefully this year is start to do little short clips, just showing particularly busy moms how to prepare quick and healthy meals. You don't have to go to the local Burger King or the local McDonald's when we're really busy. We can create meals, and even in advance create meals that are healthy and beneficial for your family.
Excellent. I love you. Well, thank you so much for your time, and have a fantastic day.
You too, Mitchell. Thank you so much.